I have a patient who has a history of progressive shortness of breath for the last 4 months. He has no previous comorbidities like biomass exposure and smoking. Despite that, he has very obvious abnormalities on the scan, which I wanted you to know in this video. So let's go for the scan abnormalities. This is the mediastinal window. We can appreciate a heterogeneous enhancing mass which is involving the upper lobe to some extent, to a greater extent, and is clearly appreciable. Apart from this, there is some sparing of the lung on the upper part of the lobe, lung, with massive pleural effusion. There is massive pleural effusion which is extending down to the bases of the lung, and we can appreciate the collapsed lung as well. There is the collapsed lung. The collapsed lung is clearly appreciable in this scan. Apart from this, we can appreciate on the lung window, this is the mediastinal, this is the mass, and this is the trachea. The trachea divides into the right and left bronchus. Before going into the division of the right, middle and lower lobes, there is an extension of the right upper lobe bronchus which is appreciable here. This is the right upper lobe bronchus, and after the right upper lobe bronchus, there is a major bronchus which is called the bronchus intermedius. So probably this patient has involvement of the bronchus intermedius. If we focus on this diagram, this is the trachea, this is dividing into the left bronchus, this is the right bronchus. Before giving rise to the bronchus intermedius, it's giving the right upper lobe bronchus, which is appreciable in this scan as well. So this patient has a heterogeneously enhancing mass with massive pleural effusion, and the diagnosis is required. The histopathological diagnosis is mandatory for the finalization of the confirmed diagnosis, and in that case there are two approaches. Either we go for the pleural biopsy, which can be done by the weights, or it can be the medical thoracoscopy or through the Abraham's needle, or we can go for the biopsy of the mass which is extendable to the periphery of the thoracic wall. So involvement in the histopathology of the mass or biopsy of the pleural will give the histopathological diagnosis.